Hello, friends, and welcome to episode 628 of the Juicebox Podcast. Today is the fourth in the Defining Thyroid series, and today Jenny Smith and I will be talking about T3 and T4. The Defining Thyroid series will be a short but important series of information about living with thyroid disease. Also about how to identify it, test it, get your doctor to take you seriously, how to get the medication right, and all kinds of other stuff. It's possible that thyroid's going to come up in your life with type 1, and knowing what to do if it happens is a big deal. Wasted diagnosis time is wasted lifetime. Please remember while you're listening that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. If you're a U.S. resident who has type 1 diabetes or is the caregiver for someone who has type 1, you could take the survey at t1dexchange.org/juicebox in fewer than 10 minutes. When you do this, it will be completely anonymous. It will be HIPAA compliant. You will be helping people with type 1 diabetes, and you will be supporting the podcast. t1dexchange.org/juicebox. If you're looking for the Defining Diabetes series, they're available in your podcast player or at juiceboxpodcast.com. At that website, you'll also find the Diabetes Pro Tip series, Ask Scott and Jenny, the Diabetes Variables episodes, After Dark episodes, algorithm pumping based episodes, How We Eat series. It's all right there. It's either in your podcast player or at juiceboxpodcast.com. At the end of this episode, and at the end of every Defining Thyroid episode, I will list the symptoms of hypothyroidism, hyperthyroidism, and Graves' disease. You want to do T4, T3 next?
Sure.
All right. Okay. Jenny, my wife has explained this to me 16 different times. I had Dr. Benito explain it to me once, and I'm still confused by it, so I'm not sure how much help I'm going to be here. But when you have hypothyroidism, most doctors are just going to test your T4 and your free T. Wait, right? See, am I right? And all right, hold on. Thyroxine T4, the primary hormone produced and secreted by the thyroid gland. In treating hypothyroidism, man-made forms of T4 are the standard method, along with T3. T4 controls your body's metabolism. If you don't have enough of them, then your metabolism slows down. In essence, T3 and T4 are in charge of how your body uses energy.
Correct.
But most people are just on a T4 replacement.
Well, T4 is really, that's where potentially, based on where your levels go after you start using some type of hormone, replacement therapy, right? Mm-hmm. Or some assistive medication, right? Essentially, T4 is the storage form of the active version of thyroid hormone you want to get to. And so it needs to be converted into T3 to get used, right?
Okay.
So free T4 is a more active form of just T4. And then once activated, this is like the baseline, like in a nutshell, right? I'm certainly not a hormone therapy specialist, but
keep going,
right. Yeah. And then it has to move to be sort of T4. It's the second hormone that's essentially, created and put out by the thyroid gland. Again, regulation by TSH, which is being put out by your pituitary gland, right?
So a free T4 test is a measure of the level of free T4 in your bloodstream. This test is complementary is a complementary test to TSH. If your free T4 levels are too low, it's a strong indicator that you have hypothyroidism. So let me see if I understand a little bit. Your body makes T4, and then from T4 it derives T3. Is that fair?
That's fair.
Okay.
Yes.
So T4 is crude oil. T3 is gasoline.
Yeah, there you go.
Okay, all right.
That's a good, yes.
If I don't put this to a picture, I'm never going to understand, because you're being clear and I'm like, my brain's going, uh-oh, Scott, you're a dummy. You don't understand. I can hear it talking to me. So, okay, so you make...
And also, I guess one another with the T4 specifically, it's a good one to get a check if you're symptomatic, but your TSH is showing normal.
Okay.
An additional to check, if it hadn't been checked at the same time, would be a T4.
Okay, that's good to bring up here. I'm going to get that information real quick. So a thyroid panel, right? So you can get a thyroid test. They even have at-home tests, by the way. And I
didn't know that.
Yeah. Thyroid stimulating hormones, TSH, free thyroxine, which is free T4, right? Look at me learning. And then, wow, I don't know this one, free triiodothyronine. Holy God.
T3. Let's just call it T3.
T3. Okay, and T3.
Much easier.
So that would be a thyroid test. But you could get a thyroid antibody test. These are, which is free thyroxine, free T3, thyroid stimulating hormone. And then I actually know this one, thyroid globulin antibodies, thyroid
peroxidase.
Yeah, antibodies, right? So,
and that one is really specific Hashimoto's.
Okay. But yes. I think my point is that don't just let the doctor send out for your TSH and nothing else.
No.
Right. At least.
Correct.
Yeah. Okay.
I would say especially now knowing what I know, obviously from a clinical standpoint, I still always ask for those along with a TSH. Even though I don't have any diagnosed, thyroid disorder whatsoever, I still want to know that where TSH is, where are my T3 and T4? Because also if I ever did have a movement towards symptoms, I have a baseline of this is where I was. Mm-hmm. This is where these have moved to now, and I am symptomatic. So clearly something is not right.
Okay. All right. So now let's say we'll give a definition for T3 here. So sure. That long word that I don't know, triiodothyronine. Okay, I'm not saying that. T3, the second hormone produced by the thyroid gland, is more active than thyroxine, which is T4, but most medications from hypothyroidism do not include T3. It says then, kind of in quotes here, your body can make T3 from T4, and taking T4 alone is usually sufficient to achieve normal thyroid function. Along with T4, T3 controls your body's metabolism. If you don't have enough of them, then your metabolism slows down. In essence, T3 and T4 are in charge of how your body uses energy. Now,
correct.
Interesting. My wife used to take T4 and T3, and it was very valuable for her, but eventually gave her heart palpitations.
Huh.
Yeah, so she had to get off of it. And I'm wondering, which I mentioned in another episode, my son said, I might have mentioned this one where he's grinding his teeth. I'm wondering if they're not going to take away a little bit, because my son takes, so our doctor's a bit of she's an outside of the box thinker. So my son takes Tirosint, which is a T4 replacement. It's a very clean T4 replacement. It's okay. And he takes Armour Thyroid.
Oh yeah. The more,
I think that's derived from a pig.
Like more natural version.
Right.
Yes, exactly.
And I'm wondering if she's going to adjust it around a little bit. So this one, because I'm not following well, this one's a little scattered, but your body makes T4, T3. When you have hypothyroidism, your doctor is likely going to replace your T4 with a medication. I'm going to just give you a couple of Synthroid. I think Synthroid's pretty much the most
Correct. And the Armour, I've actually heard a lot more in probably the past 5 years. I've heard more people using the Armour.
Yeah. You most commonly might see it. There's a synthetic form of the hormone, like we were just saying, that Armour is more natural. But you might see it called Synthroid, which I think is a name brand. You'll probably more often see it as levothyroxine, which I think is that's the actual molecule name, I believe, right?
Yeah, it's essentially Synthroid.
Yeah.
It's just
I can tell you that Synthroid works for my wife, but the generic of Synthroid doesn't.
And that's a really important piece too. I mean, there are lots in terms of talking about those hormones and then the replacement therapy meds for them, because there's a whole bunch about the medication that's really important to pay attention to for yourself. Like you just brought up, if you've been using the brand named product and you switch over and something doesn't feel right,
something's probably not right.
To go back. Something's not right. And in that, you might even need to have your prescriber write the order as no substitutions on the prescription.
Yeah.
Please prescribe only this brand, this dose, etc. I mean, that also goes into like how to take the medication, foods that might interact with the medication. I mean, there's a lot with the thyroid meds.
You can't take, you're right. And we'll do an episode probably at the end of this where we just talk about how to take the medication.
Cool.
Time of day, what you can't take around it. There's
yes, there's a list.
Yes,
be ready. Get your notebook out.
Vitamins you can't take at the same time. Like all kinds of stuff.
And how many hours between taking the vitamins and things? I mean, it's
it's really something. Nothing else fits with this one, right?
I don't think so. No.
Okay, so we did T4, T3.
I should mark them off on my list here.
We're doing really well.
Yeah.
I'm very proud of us. Because, we'll get to thyroid. I don't think we have enough time to do thyroid hormone replacement right here. I'm looking for something that fits in the time you have left. We could do antibodies, which I think I think they deserve their own. All right. Now I feel like we've given away that we record these in big bunches. But hey, Jenny, I was hoping today.
Hey, Scott.
I was hoping today that we could define antibodies in general and around thyroid disease. So
sure.
I'll read.
You want to read the definition?
Yeah, sure. Why not? Proteins produced by your body's immune system that attack invaders, such as a virus. However, antibodies may also mistakenly attack healthy tissue. When antibodies attack the thyroid, it can stunt thyroid hormone production. This may result in hypothyroidism. So I think everyone listening who has type 1 diabetes, if you don't know, this is what happened to you. And you have type 1 now, right? So antibodies are, I mean, what's a simple way to think of it so that, make it cartoonish for me so I can follow.
Make it cartoonish. It's like an invader, right?
Okay.
So if you think about an antibody, it's essentially something that your body produces to attack the invader.
Okay.
So it's like calling out the troops, right? Mm-hmm. They're sitting and just like playing cards and doing whatever they're doing. And then they're like, oh my gosh, we've got this strange looking blob floating around in the body. We have to take care of this, right? But sometimes your body gets overboard, right? Especially with autoimmune disorder. And it doesn't know when to stop that sort of attack on what it sees as a foreign body. And in somebody with autoimmune disorder, unfortunately, that foreign body isn't really foreign. It's a part of your body that's supposed to be there, such as the beta cells or such as, different parts of the thyroid gland, et cetera. So
these antibodies are a good thing until they get confused.
Correct.
Or supercharged maybe by an
or supercharged. Yes. They've had way too much Red Bull or whatever is the newest thing.
Yeah. All right. So I understand. So an antibody is Superman, right? Until all of a sudden it turns into that like creepy version of Superman. What was that called?
Oh, he was like the Bizarro.
Bizarro. His name was, good job,
yes.
Jenny.
Thank you. Well, I do have two little boys.
That was well done.
They love the superheroes.
That was really well done. Just yanked that right out of your ass. So
we do get the superhero comic books from the library, and we read them many times.
Okay, well, that's obviously stuck in your head because I couldn't think of it. I could picture him in my head. I couldn't come up with the name. So generally speaking, my antibodies are a good thing. Get a little,
Correct.
Right.
Yes. That's obviously also how our body deals with attack from typical viruses, right? You build up an antibody, and then if your body encounters that again, essentially it's supposed to be able to manage it either better, or it manages it and you never actually get symptomatic.
Yeah. But sometimes things go crazy, especially if you have autoimmune disease. And these antibodies will do the wrong thing. So, just because we're here right now, and it's such a super simple thing, but I bet you we've never said it out loud. It's the antibodies in the situation of type 1 diabetes. They actually go after the beta cells in your pancreas. Because I think people just think of the pancreas as being.
A pancreas is not dead just because you have type 1 diabetes.
Right. It actually still does things that are very important.
There are actually alpha cells also in the pancreas.
Oh, look at them.
It
left them alone. It just went and got the beta cells.
Just takes care of the beta cells. Yep.
And there are people too there's researchers that believe that the beta cells aren't destroyed as much as they're frozen in inflammation. Have you ever heard people talk about it that way? I've not heard it talked about that way, although I have, even years ago when I was working endocrine in DC, there were tests that were being done on people with 20 plus years with type 1 diabetes. And what they were finding is that their what's called C-peptide levels were actually not nothing. If your C-peptide levels are nothing, it essentially means that you no longer have any assisted beta cell action happening in the body. Okay.
But many of those tested actually did have a small level of continued insulin secretion from the betas that are left, essentially working in the body. The problem being the autoimmune system continues over time to identify those as foreign bodies. Right?
They didn't just come in and attack once. They keep coming back if the beta cells relight their campfire, they're like, oh, no. Here we come again. All right, I got it. All right, so antibodies, little invaders, are there actually to attack the invaders in your body.
They're there to attack the invaders,
but
yes.
Sometimes get confused and attack the good stuff. So just think of antibodies as Superman until you have an autoimmune disease when they become Bizarro. There. We did.
I call that the Bizarro episode.
If I hear anyone in the diabetes community refer to it like this, I'm going to assume that you and I did that. So I have never heard anyone talk about it that way before in my life. So, all right. Well, Jenny, thank you very much for doing this.
Yes, absolutely. Bizarro's planet is square, by the way, if you didn't know that either.
It sounds like
just to let you know.
Is it really?
Yes.
All right. I'll look that up. Hold on a second. Thank you very much. I appreciate this very much. Thank you.
Yes.
Cool. So we got through a good Thanks so much for listening today. Please stop back frequently for more episodes of the Juicebox Podcast and to continue with the Defining Thyroid series. If you like Jenny, she's for hire. You can find her at integrateddiabetes.com. She helps people with their type 1 diabetes. She's really good at it too. If you're enjoying the Juicebox Podcast and you're listening in an app but you're not subscribed or following, please hit subscribe and follow in that app. And don't forget to tell a friend. Hey, if you find the podcast on YouTube, we started putting up animated versions of the Defining Diabetes series. They're really cute, great for kids, very visual. Go find it. All right, now let's go through the symptoms. We will start with hypothyroidism. Hypothyroidism signs and symptoms may include fatigue, increased sensitivity to cold, constipation, dry skin, weight gain, puffy face, hoarseness, muscle weakness, elevated blood cholesterol level, muscle aches, tenderness, and stiffness, pain, stiffness, or swelling in your joints, heavier than normal or irregular menstrual periods, thinning hair, slow heart rate, depression, impaired memory, enlarged thyroid gland. In infants, you're looking for a yellowing of the skin and whites of the eyes, which is commonly called jaundice. In most cases, this occurs when a baby's liver can't metabolize a substance called bilirubin, which normally forms when the body recycles old or damaged red blood cells. You also might see a large or protruding tongue, difficulty breathing, hoarse crying, or an umbilical hernia. As progression happens in infants, you may move on to constipation, poor muscle tone, or excessive sleepiness. Hypothyroidism in children and teens may indicate with poor growth, resulting in a short stature, delayed development of permanent teeth, delayed puberty, poor mental development. That list is from the Mayo Clinic. Let's move on now to hyperthyroidism. This list is from the Cleveland Clinic. Hyperthyroidism may present with rapid heartbeat or palpitations, feeling shaky and or nervous, weight loss, increased appetite, diarrhea and more frequent bowel movements, vision changes, thin, warm, and moist skin, menstrual changes, intolerance to heat and excessive sweating, sleep issues, swelling and enlargement of the neck from an enlarged thyroid gland, hair loss and change in hair texture, it would get brittle, bulging of the eyes, as seen with Graves' disease, and muscle weakness. Okay, back to the Mayo Clinic. For Graves' disease, you're looking for anxiety and irritability, a fine tremor of the hands or fingers, heat sensitivity, and an increase in perspiration or warm or moist skin, weight loss despite normal eating habits, enlarged thyroid gland, change in menstrual cycle, erectile dysfunction or reduced libido, frequent bowel movements, bulging eyes, fatigue, thick red skin usually on the shins or tops of the feet, rapid or irregular heartbeat, palpitations, sleep disturbance. If you, your child, or someone you love has any of these symptoms, please seek medical attention. I want to thank you so much for listening and remind you again to please go to t1dexchange.org/juicebox if you're a U.S. resident who has type 1 or you're a U.S. resident who is the caregiver of someone with type 1. Your quick and easy answers that are HIPAA compliant and completely anonymous will be of great value to people living with type 1 diabetes. It will take you fewer than 10 minutes at t1dexchange.org/juicebox to make a huge difference in someone else's life. And you'll be supporting the podcast. Thanks so much again for listening. I'll be back very soon with another episode of the Juicebox Podcast.